Good afternoon. So pleased to have you join us today for a conversation of hope. Give a few minutes as we are having some additional people joining us, but very much looking forward to the conversation today. I am Kelly Sweeney McShane. I am the CEO at Community of Hope. And just to note, we are in a Zoom webinar format. And uh, myself and the other panelists cannot see your faces, and you are muted. But we are looking forward to having a conversation among our amazing panelists, as well as with you in our audience. So thank you so much for joining us today. Throughout our conversation, and again, we will have an opportunity for questions at the end. We encourage you to put your questions into the Q&A component. We are also recording this conversation, and we will have it available to share later for those who would like to follow up. It will also be available on our YouTube channel next week. So again, thank you so much for joining. I'm going to wait just one more second as a couple more people are joining us as well, and then we will get into the meat of our conversation. So today we are going to talk about our HONEY program, which stands for Housing Our Newborns, Empowering You. I think it is incredibly important, incredibly relevant that we are having this conversation today on the last day, the Friday of Black Maternal Health Week. This is the 10th year of celebrating Black maternal health. And I think a very important part of the conversations this week and throughout the year is to highlight the continued disparities for Black birthing moms in particular. Black women are 3 times more likely to die during childbirth than their white counterparts, according to the Centers for Disease Control and Prevention. And data for the District of Columbia shows that 90% of pregnancy-related deaths occur among Black residents, with the highest risk concentrated in Ward 7 and 8. This is also a great week, though, to highlight solutions and make sure we're bringing joy and justice into the birth conversation. And so today we're really excited to talk about one solution that Community of Hope has been providing, our HONEY program. As a Community of Hope, just a little bit of background about us is that we focus in the District of Columbia, and we are both a community health center providing medical, dental, emotional wellness, and a strong maternal and child health program, as well as a provider of services for people experiencing homelessness in the district. So we are very much in a unique position to understand the intersection between pregnancy and homelessness. And while there's not a lot of data or comparable data that we've been able to find around people who are both pregnant and homeless, we do understand and know that there's an increased risks for poor maternal and child health outcomes. The housing instability, the mental health strains of being homeless and of being pregnant all become exacerbated when you don't have some place to live. So Community of Hope has really worked to address this situation and bring together our strengths to help people within the District of Columbia. Today, we're excited to share what we've learned. And it all starts for Community of Hope as well with our maternal and child health model. We center primary medical care and emotional wellness with all of the households that we work with, and we work with just about 16,000 patients across our health centers. But when we've built a very robust model of maternal and health services that include midwives who deliver babies at our freestanding birth center, as well as at a Washington Hospital Center. We have doulas. We have a significant and strong perinatal care coordination program that you will hear about in the HONEY program. We offer pediatric care, evidence-based early childhood home visiting. We have home-based postpartum care. We provide breastfeeding support. We also offer WIC services and then provide multiple baby items. Out of both this maternal and child health model and our homelessness work is how the HONEY program was born. And the concept is that we are serving anybody in the District of Columbia who's experiencing homelessness to make sure that they are connected to important prenatal care. This work started many years ago through a private fund from the Bezos Day One Family Foundation, where we had the opportunity to dream big and to think about what could we do with unrestricted funding. And we decided we really wanted to focus on this intersection of pregnancy and homelessness. So we hired an internal perinatal care coordinator who worked closely with families within our housing programs. Out of that, we then got very involved with the DC Health and the Office of Health Equity, particularly Dr. Arno, one I recognize from the DC Office of Health Equity, who led a project through Pew Charitable Trust called the Calling All Sectors Initiative, working with Community of Hope and multiple government agencies to again focus on pregnancy and homelessness, with some significant recommendations that came out of that report. Based on that report, we then applied to HRSA for a quality improvement fund around maternal and child health. It was a national competition. We were pleased to win an award of $2 million over a 2-year period, which really allowed us to fully build out and scale this model. We also received a support from Optum Health to support this model in the early days. The HRSA funding has since ended, and we're continuing the work with philanthropy, so we can talk later on about sustainability. But we are very excited today to share more about it, as well as some of the outcomes from a recent evaluation that we've done. So with that framing, let's get into the conversation. I'd like to have Morgan, our program director, join us. And Morgan, if you could introduce yourself and your role at Community of Hope.
Hi, yeah, I'm so excited to be here today. My name is Morgan Carrillo. I use she, her pronouns, and I'm the program director of Honey here at Community of Hope.
Morgan, can you just start by sharing who is eligible for services for Honey?
Yes, so for Honey, folks are eligible if they are pregnant or within 6 months postpartum, and also eligible for services with the DC Department of Human Services. They don't have to be part of Community of Hope housing or receive their prenatal care at Community of Hope to be in the program.
And we'll hear a little bit later from Kia Williams at Department of Human Services about what that means to be eligible for homeless services. Can you talk a little bit about what services Honey provides and how we do that?
Yeah, so in a nutshell, we provide both perinatal care coordination and navigation services to families that are experiencing homelessness while pregnant or in the postpartum period. When families come into our program, they have the option of either opting into perinatal care coordination or perinatal service navigation. Um, and through perinatal care coordination, families are assigned to a PCC or a perinatal care coordinator who remains with them throughout that pregnancy into their postpartum period. The PCCs assess for needs and barriers to support, access to care, and provide them with twice monthly home and community visits where they can see them in their environment and make sure that they're giving them those supports that they need. We also can help provide transportation support to healthcare visits for parent and baby through our partnership with Uber Health, as well as provide some needed pregnancy and postpartum items that are those material resources that can be really helpful in times like these. Um, for folks that might feel really supported, they might have a really great case manager through their housing program. They might have a wonderful doula who's providing good education around that trimester-based education that we provide. They might decide that they don't want the care coordination part in those home visits, but they might want to touch base with our outreach and training specialist a few times a month for a short duration and get just warm handoffs. So that's kind of what we provide in a nutshell. And that's kind of like the difference between the two.
Well, and you talked about navigation and care coordination. So navigation is sort of the lighter touch.
Yes,
And on care coordination, that's sort of deeper about how many families do each care coordinator work with?
so we like to keep them around 30 families, but we do assess needs and also the capacity of the staff member and kind of see who would be the best fit. So sometimes we might go a little bit over that, but right now we're not, which is great.
So Morgan, what services don't we provide? Because there has been some confusion about this, so I want to make sure that we're clear.
Yeah, great question. We get this a lot. We do not provide housing. However, we do partner with housing case managers to make sure that we're supporting families through their pregnancy and postpartum period, but we don't provide housing.
Um, so can you talk a little bit about what care coordination looks like on a day-to-day basis?
Yeah. So each day would look really different depending on a family's individualized goals that they've set with their PCC. But day to day, a PCC might be attending a prenatal appointment with a client or visiting a client's new home to make sure that they have a cribette and provide that safe sleep education. They might be joining a housing case manager to advocate for the family's needs, or they might be completing even a depression screener to make sure that a family has all the emotional wellness tools and supports that they need during the period of time that they're with us. So, again, every day would kind of look different depending on the goals that the client sets with their PCC. But our job is just to make sure that they're supported and they're feeling like they have someone in their corner that can get them where they need to go.
And then what about the prenatal care? Can you talk a little bit about when women are coming and what trimester they're coming, and then how they're connected, or are they already connected with prenatal care?
Yeah. We're really proud of how we screen and ensure that folks are getting that important prenatal care. So, during intake, families will be asked by our outreach specialist if they're receiving prenatal care, where and how the quality of that care is. We will kind of make sure that they are enjoying their time there. They feel like they're getting the support that they need. And I would say that the majority of our families are coming in already connected to a prenatal care provider. But for those of them that are not, we are working to ensure that before that first visit with their PCC, that they're already connected, that we give them those referrals. And our outreach specialist will then flag that they're not connected to a provider yet, so the PCC can make sure that they are within that first visit. And the second part of your question, we're seeing that most folks are coming in to the program in their second and third trimester. Currently, I believe out of the referrals that we have, 45% are in their second trimester, and around 33% are coming in the third. So lots of time-sensitive work being done by the team on that one.
We're getting some good questions in, and I want to get to a couple of these. But before that, we do that, an important part of this component was having a community advisory council. Can you just talk a little bit about that role, and if there's some feedback that's been provided that's been really helpful to us in designing and maintaining the program?
Yeah, so our Community Advisory Council, or our CAC, meets quarterly and is made up of current and graduated honey clients. And we invite them to share their lived experience of pregnancy during homelessness, and as well as their experiences, honestly, in the program, because we really want to make sure that we're serving them better and that we're providing what they want to see. So last year, something that was really helpful is that our CAC members shared that they really wanted a community aspect to the program. They talked about how experiencing homelessness during this period of time can be really isolating, and not everyone understands what it's like, right? And so, creating a space where they could talk to one another about their unique circumstances and experiences, and also the joys of being pregnant during a challenging time, right? But still getting that feedback was really important. So we created Beyond Birth Circles. It's super cute. They're BEE, Yond Birth Circles. And they're facilitated by our outreach and training specialist. And sometimes we get external experts as well to come in and facilitate discussions. But they're on various topics each month. We've done a few on self-care in pregnancy, emotional wellness during pregnancy, and we have one next month on balancing work and childcare. So really great things. And I think we've gotten good feedback from existing clients about how it's been a nice addition to the support from their PCC.
Why don't I'm going to take one question and let's move on because we do have a participant to share and then we can come back to some of the questions at the end. There was a question around insurance. Do we help people coordinate or connect with medical insurance? And does insurance or Medicaid work along with our services?
Yes, so we do connect folks. We generally see that most folks are connected when they're coming to us, but if they're not, that's one of the first things we do when referring them out to prenatal care. We also do support them with their managed care, like provide. We will try and assist with like transportation connections and things like that. So we do reach out to insurance to make sure that we're using every tool that we have to support the families.
Great. I know we have a couple others we can come to at the end, but I want to make sure we have an opportunity to hear from our participants. So if Maya would like to come on screen and Morgan, I'll hand it over to you to have that conversation with Maya.
Thank you. Hey, Maya.
I
Hi. So now that everyone has had a chance to listen to me talk a little bit about the program, I would love for them to hear from you as the best person to talk about it as a graduate of our program. Um, so could you just first go ahead and introduce yourself, tell us a little bit about you and your new baby B?
so I'm Maya Patterson. I have a 7-month-old daughter now. I believe I came to the program when I think, in my second trimester. I didn't even know the program existed. I was referred through Zoe's Doors, which also refers to as DC Doors. Yeah, that's how I got started with you guys.
Thanks so much for sharing. I'm going to shift us a little bit to talk about what things were like before Honey. Can you talk a little bit about your housing situation and about your pregnancy before you were referred to Honey?
So before I got introduced to Honey, I was living on my school campus, which doesn't really include, having a baby. So I was kind of like in a state of panic, I'm like, oh my goodness, where am I gonna move to? You know how housing is in DC, it's very income demanding and scarce. So I was just kind of panicking a lot, trying to see where I would be living with my child upon giving birth. So that was a little, stressful for me at the time.
Yeah, yeah. It sounds like that would be really stressful, and also to try to balance the pregnancy and all of the good things and the bad things that come with not knowing where you're going to go, right? And not knowing what supports will be in place.
Definitely.
Um, Great. Thank you so much for sharing that. I know it can be hard to go back to that time too. What changed once you were connected with Honey?
Well, immediately they told me about any and everything that they could. Like I was having trouble going to appointments, like getting away to and from my appointments. I was having trouble. Honestly, I can honestly say with everything, like food resources, job resources, and once I got connected with also two people from the program. One is no longer there, but Khadijah definitely helped me. She made sure that my baby had wipes, my baby had diapers, that I knew of daycare services. I had a ride to and from my appointments, even when I had an emergency appointment, because I was definitely a high risk pregnancy. So I had to go to the doctor at least 3 times a week for checkups, not including a random emergency visit or things like that that I would have to go to the emergency room. And being as though the father of my child did live a bit far in the Maryland area, it was kind of hard for him to get to me sometimes, although he did have a car. It was like, stuff about pregnancy is really time sensitive. So it's like those Ubers and Lyfts, they honestly really saved me a lot. And I'm really grateful for that because just besides my health, of course, I was also worried about, the health of my baby. And it's my first time being pregnant, my first pregnancy. So yeah, I was thinking any and everything.
Yeah, makes sense. I'm so glad that you feel like we were able to provide that support then, because it's such an important time, and it can feel really you can feel really alone, right? So I'm so glad. how did participating in the program impact you as a parent, as a mom? How did it give you the tools that you need to be successful as a parent?
Well, when we would go to like me and my daughter, we went to the little like, the B meetings and things like that. And I was hearing not just moms, but a couple of dads also share their stories. It kind of made me feel like, okay, I'm not going crazy. I'm not insane. Like this is normal to feel. These things are normal to go through. Stuff happens. So it made me feel like more confident in what was going on in my life and that there was a way out and a way to like, not be in that situation and to aspire to be great, have a good outcome, which I definitely am in now. Um, it made me like also reconnect with myself as well as like my daughter because most times I'll be like, in the house, or it's like I didn't have such a I would say I didn't have like the mindset at the moment to think outside of what was going on in my situation. So I didn't know how to care for myself or how to do little things to like get me and her out of the house, but still like being sane or being close to the house and not having to spend money or do, a lot of extra things.
Yeah, yeah. Thanks for sharing. It seems like you made so much progress in the program and for your baby, and we're really proud of you, of course. But it's wonderful to hear all the progress you've made. Um, Before we wrap up, I know that you participated on our community advisory council when you were in the program. Can you tell me about that experience, participating in the group to make services better for others? How did that go for you?
It was nice because everyone was really open-minded.
Mhm.
And when we did give our like suggestions, I like that they were like, oh, well, how do you expect this to happen? They weren't just like, okay, thanks for sharing. Like they genuinely asked follow-up questions like, oh, what makes you feel this way? Or what benefit would other people get from this? Or asking us about like, I would say like they asked us about questions that normally people wouldn't ask you. Like I can sense the genuine care and concern for for them to try to see us do better, and as well as like the future people that come to the program as well. And that made me feel like really cared for. It made me feel all good and fuzzy on the inside because I'm like, oh, they really care. Like they're not just like just doing this for studies or something like that, or to get information. Like they genuinely care and want to see a change. You know what I'm saying? So that like made me feel a lot better because I also referred a lot of people to the program that, like I said, didn't know about it, just like me. And I was just like, I don't want anyone to miss anything like this. And that also made me think about other things like, okay, so even when I'm out of the program, how can we get them funding or things like that? Because I would love for someone to feel what I felt in my time of need when they come to the program. Because I know that there's people in better situations and worse situations than me. And the relief that Honey took off of my shoulders and off of my heart and the burdens that it relieved for me are truly like sensational, like I can't even describe it. Like it was something that I can never replace in my head or anything like that. Like it's just overall great feeling. Like I get emotional a little bit, but because you guys really helped me more than you think, like mentally especially. I was in a really dark place, and I'm just so happy that you guys brought the light back out of me.
Thank you so much for sharing. I was going to ask you if there was anything else that you wanted to share, but you've said it beautifully there. But is there anything else that you would like us to learn and our participants to learn about you, or your family and your experience in the program?
Well, at the time, actually, my daughter was in the NICU. She was born a few weeks early, and like they said, they do help you postpartum 6 months, and that was I was really grateful for that because me having to go to the NICU every single day for 3.5 weeks straight was really stressful. Was really hard. They were always checking in on me, making sure I was okay, mentally, and I was there. And since I was also going to school full time as well, they're making sure like I was taking the time I needed for myself and not like overwhelming myself and shutting down. So the casual check-ins, like, hey, you okay today? Or hey, you want to talk? Or, things like that. It just really meant a lot to me that someone cared about me more than myself or like outside of their designated job role. Like it wasn't just a job for them, that they genuinely really cared about me, like as a friend or family member.
I'm so glad to hear that.
That's making me cry.
Yeah. Um, Thank you so much for taking the time to be open with us and share your story. It really means a lot to us, and we're so very proud of you and baby girl and the progress that you've made.
Thank you guys so much. We can't thank you guys enough. We can't repay anything you guys have done. We truly love you guys.
Well, now that you've heard that beautiful testimony from Maya, we'd love to share a short video with you that talks a little bit more about the work that we've been doing. So we'll give it to the folks to take away.
Tonight, a program that helps some of DC's most vulnerable new moms, and it's showing some promising results.
Yeah, our Randy Hildreth explains the impact it's having on moms and their babies.
T-Roya Jackson was at her wit's end while pregnant with her youngest son.
Overwhelmed.
The now mom of 5 was preparing for birth while facing homelessness, with her doctor warning her.
My doctor was like, you have to calm down, you have to relax. If not, your baby's going to come out just as stressed as you are.
That's when she was introduced to the Honey program in DC. Stands for Housing Our Newborns, Empowering You.
Our role is to connect moms to prenatal care and really support them in that prenatal period, postpartum, and also during labor and delivery.
That's Kelly Sweeney McShane, president and CEO of Community of Hope. The agency is a homeless service provider and community health center. The Honey program is offered at no cost to eligible moms. 2 years in, it has served more than 300 moms and a little over 200 babies. A new study done by the George Washington University Center of Excellence in Maternal and Child Health found the program is working.
Saw a significantly lower rate of preterm birth, about half the rate of the DC average for African American moms on Medicaid. This is a population that is generally at more risk anyway for social factors. So the fact that we're seeing such good outcomes, I think, is even more important.
Sweeney McShane says the center is tracking numbers that show more families are experiencing homelessness and the need is growing.
We do believe that the number of moms who are pregnant is growing, and we want to be available to be a resource for those who need it.
Jackson says the program helped her family find shelter, access medical care, and food assistance until they could get back on their feet. She says she owes a lot to the Honey program.
A lot of people are living right next to missing a paycheck and having everything fall apart. I just really, really, really wish we were all just a lot more graceful to each other, and I felt a lot of grace in the Honey program.
Randy Hildreth, WUSA 9.
I hope you enjoyed. I love the baby photos. It makes my heart so happy. And Maya, thank you so much for sharing your story. And we're so great. We're so pleased that we were able to be with you and so proud of everything that you are accomplishing with your daughter. And we'll have you back on for questions as well. I see lots of praise and gratitude for you coming in the chat. So I want to invite Dr. Don Sherman to join me, and we're going to talk a little bit about doing a formal evaluation that we did just discuss. So Don, if you want to introduce yourself and your role.
Good afternoon, everyone. I am Dr. Dawn Sherman. I serve as the Vice President of Community Impact and Evaluation here at Community of Hope, and I use she, her pronouns.
So Dawn, we did just complete an evaluation with the George Washington Center for Maternal and Child Health Excellence, or Center for Excellence for Maternal and Child Health, and we did both a quantitative and a qualitative study. So can you just tell us a little bit first about the evaluation process and the numbers that we were taking a look at, and then we'll get into some of the results.
Of course. So we conducted a mixed methods evaluation. So we looked at our quantitative data, our numerical data, as well as qualitative data, conducting interviews. And as you mentioned, Kelly, the study was conducted by the George Washington University Maternal and Child Health Center for Excellence, led by Dr. Karen McDonald. And they examined the implementation of the program. Were we implementing the program as we intended, and the overall impact of the program related to birth outcomes and overall family experiences in the program. We looked at quantitative data for clients in the Honey program from November 2023 through September 2025, and we conducted 40 interviews as well with key stakeholders, including Honey staff, COH leadership, and of course, our clients and external partners.
So let's talk a little bit about the qualitative results. And again, I think we've heard from both Maya and Troya, who's in the WSA 9, about how overwhelmed they were feeling beforehand and some of that. But give us a couple of highlights from what their other feedback was providing.
Sure. Overall, our clients truly appreciated the support that they received from their PCC, their perinatal care coordinator. Having someone walk with them through their pregnancy and support them up to 6 months postpartum while navigating the homelessness continuum was such a great support to them. Our PCCs provided emotional support as well as tangible, reliable guidance throughout their perinatal period. From the stakeholder perspective, the Honey program met a need by connecting our families with the resources they needed at the time they needed, helping our families have happy and healthy pregnancies while navigating the homelessness continuum. So it was a benefit for our partners as well.
And then how about the quantitative data and the outcomes? Because we have some really great information to share there as well.
Yes, so to frame it slightly, over the review period, again, which was from November 2023 through September 2025, we served 215 unique clients, all of whom were eligible for homelessness assistance services in DC. 95% of our clients identified as Black or African American, and nearly 80% of our clients enrolled during their second or third trimester. Some of the biggest takeaways: we did see a lower preterm birth weight for our Honey clients compared to African American families in DC utilizing Medicaid. And we also saw a slightly low birth weight rate for our families as well.
And can you tell us on the preterm birth, it was a pretty significant reduction comparable. And what were those numbers looking like? And I think we do have a slide as well coming up, yes, that you can see visually there.
Yes, so we saw a significant difference between our preterm birth rate for Honey participants compared to the rates for African American, non-Hispanic Medicaid funded births in DC. So as you'll see in the bottom half of your slide, 15.5% of DC African American families utilizing Medicaid experience preterm birth. For our Honey participants, that rate was only 8%, so nearly half of the rate of our similar families in DC that were not utilizing Honey services. So we're extremely proud of that number.
And those numbers are very hard to move. So even a 1 or 2% change, and this is again half. When I look at the numbers, and maybe Dawn commenting on the low birth weight, it's just a little bit lower. But again, given the higher risks, especially around homelessness, I think those are also very strong numbers to report. Anything else you would share with that?
I think overall, I think our team is very proud of these numbers and the impact that they're able to make. I think one of the things that really came out in the data, not only the quantitative numbers, just looking at the birth outcomes, but also in the interviews, being able to connect with the members of our team, being able to connect with Community of Hope as early as possible during their pregnancy, and having that constant check-in, having someone to follow up with them on their medical appointments and their health needs, as well as their social needs. Those social drivers of health really went a long way to making sure that they had a wonderful experience during their pregnancy, and of course, that additional support postpartum.
And we know that that not listening to Black women and not respecting are such an important part of the why we're in the situation that we are in. And so really being able to support and encourage moms during this period is, I think that's why I think we're seeing some of these changes in some of these outcomes. So
absolutely. It's in the name. empowering you. And
Yeah.
we take that to heart. We really wanted to empower our families, give them the tools to be successful and to be stronger advocates for themselves during the perinatal period.
So thank you, Dawn, and we'll have you come back on in a few minutes for additional questions as they come in. But I'd also like to know, I have Kia Williams from the Department of Human Services join us to talk a little bit about the partnership. So Kia, if you want to introduce yourself and your role. Oh, and you're still on mute.
I should know more about this by now. Thanks for having me. I'm Kia Williams, Program Manager for the Virginia Williams Family Resource Center, which is the central intake for homeless services here in the district.
So for those not familiar with the district or not as familiar with homeless services, just tell us a little bit about the landscape and especially the important role that Virginia Williams Family Resource Center plays.
All right, great. So Virginia Williams is, as I stated earlier, is the central intake for homeless services here in the district. And households that we do refer to Honey must complete an eligibility process for homeless services. They have been deemed eligible for homeless services. They either were connected to one of our 4 prevention sites, homeless prevention sites, meaning those households had a safe place to stay, or they're currently in their unit. There may be some changes that are ahead. So we're able to get them connected to one of our prevention sites, and Community of Hope is one of those. Or either they can be placed in one of our short-term family sites. We have one in every ward except one. And we want to ensure that if that individual does appear and reports that they are pregnant, we want to get them connected to Honey. We know that it has been beneficial providing that support. And also noting our low barrier shelters. They may not need to go into our family shelter, but they're currently in a shelter, and we get them connected to one of our prevention sites along with Honey to assist them during their pregnancy, so we can get them that prenatal care and also following up after the birth of their child. Especially if they stay in contact with us, we want to make sure that that service is provided to them.
Again, just for those who don't know the DC system, the low barrier sites you're referring to is if there's a woman who has yet to have a child versus someone in the family system who already has a child, right? So
Yes.
looking across the two different systems. Do you have an idea, about how, I know as we were doing this process, it was hard to figure out how many women actually are pregnant and homeless. So can you share a little bit about what that number looks like now and what the need is?
Yes. So for FY25, we had about 519 pregnant individuals to report to Virginia Williams. As I stated, those families must be deemed eligible to be referred to HPP, but they might have been contacting us for other services. But we do know 519 contacted Virginia Williams for some service or some need. For FY26, as of March 31st, we've had 271 households to report to Virginia Williams who reported that they are expecting. We've seen an increase and we've seen a decrease, and we're just at the beginning of FY26. So we're encouraging those households to follow up with Honey once the referrals are sent over, so we can ensure that they are connected to the services that are available to them.
And one of the things I think that back to this question, what we don't provide, because Honey can't provide the actual housing, the idea is that they are connected and eligible for homeless services. So they're getting some of that stability or along that pathway while we're providing that important prenatal connection. And again, I think we want to keep getting the message out about that particular component of it.
Yeah, and that's why it's so important to have that communication between the parties. So if a household is connected to our short-term family sites, we ensure that the case management team works hand in hand with Honey, because we want to make sure that all parties that are working with the household knows what's going on, and then they can work together as a team as they transition into permanent housing. Same process that we use with our homeless prevention. And I think that's very important, especially with the continuum of care that we work in. A lot of our households are connected to other resources, but we know that those come from Virginia Williams in partnership with Honey. We want to ensure that we keep that teaming approach, keep that staffing, so all parties that will know what's going on. And then also as they transition into permanent housing, Honey's team will know exactly where that household is so they can follow up with them after they exit one of our programs.
So in doing our research, we do think this is a unique model. I haven't heard anyone else who's really doing this across the US. So just Kia, your recommendations, if there's other jurisdictions who are interested or thinking about it, what suggestions you give, what worked, maybe what have been some of the challenges? Would you encourage other jurisdictions to think about this?
Yeah, well, the first thing is don't be scared. I think that's a lot of times when we see something that's needed, but we're scared to approach it. We're scared to implement it. That's one thing you definitely want to stay away from. But also, it's about partnership and communication. You need to work with your continuums, find out what is missing, find out what resources can be beneficial, and how you all can work in partnership to create a honey. We know at times it has been a little difficult to get the household. So we went on a road trip. We informed providers like, hey, don't be scared of it. This is a program. You have this, you see this. Let's get these households connected. I think if teams can follow those approaches, honey is possible all over. And we know Community of Hope will be willing to take the show on the road. But it's a great program. We're not just saying that just to be up here today with you all, which we're so glad that you joined, but it's a part to be part of it, to see how we implement it, how the name came about in one meaning. It means a lot, and it's a great program that has really assisted a number of residents here in the District of Columbia.
Well, Kian, it's great to partner with you. And I think that partnership, that public-private partnership, is what makes it really possible and to connect. And I think in the beginning stages, when we were doing research, we realized that a lot of the homeless services providers didn't know anything about prenatal care, and a lot of the prenatal care providers didn't know anything about homelessness. So this has been kind of our attempt to merge those two together. And to your point, going out and talking about what those services are available.
And not just your shelters, also our hospitals. We've had conversations with the different hospitals, and I'm training the staff just to let them know that we have this. Because a lot of times they don't inform their physician, and the social worker may get that information. So we definitely work in partnership with them also too.
Great. Anything else I didn't ask that you wanted to share? Just make sure I covered everything.
No, I think we hit it. If it's anything that I missed, because sometimes I can go talk, but I want to make sure that, people understand what we do and how it's a very important program.
Great. Thank you, Kia.
All right.
So I think at this point, we're going to transition into some questions. We've got a couple popping in. So if I think if everybody can come back on screen, and then we can have a conversation amongst all of ours, and also refer questions to different people coming in. So I am taking a look at a couple of these. One question here, and Morgan maybe would be the one to answer about the difference between honey and home visiting services like Healthy Families America and Nurse Family Partners. And I would just say Community of Hope does offer Healthy Families America and Parents as Teachers as some other components. But Morgan, do you want to talk about the differences or the similarities?
Sure, yeah. The reality is these are all really great programs that provide so many important supports to these families. And we partner a lot with those programs as well, making sure that families are connected after they leave our program moving forward. But I think one of the unique things about our program is that our team is integrated into Virginia Williams. So we're able to meet with families, also team with the Virginia Williams staff when necessary to make sure that we're providing all the supports that we need to do. It's a nice way to make sure everyone is connected. Our team is also especially trained around issues in the intersection of perinatal homelessness, right? And so I think that we are able to do that pretty well. But we also know that our program does end at 6 months. So we're always wanting to make sure that families are connected to home visiting programs that go longer term. They're using all of the supports that they have available to them. I hope I answered that.
Yeah. And Morgan, there is a question about could we go to a year postpartum? And there are some reasons we decided not to, but Morgan or Dawn, if you want to answer that question.
I can start, and then Dawn, if you want to hop in, yeah. So mostly it's capacity. It is right now, our team is small, and we want to make sure we touch as many folks as we can. We also do feel like we're able to provide referrals and resources for longer term support. We do also see within our program a little bit of a drop off once folks have had their baby. And so we need to maybe look eventually at like what that support would look like if we were to go long term. But right now it's based primarily on capacity of the team. And we want to make sure that we're touching them in the most vital part of their journey.
And I would just add, the other thing is we do referrals to home visiting, right?
Yes.
So if somebody at 6 months wants to transition to another 2 to 3 year program, that is also part of the flow as well. And then there is a question of how large is the staff of the Honey program? I think that's another Morgan question.
So we have, oh, I should have prepared this number, but we have 5 perinatal care coordinators. I have 1 lead perinatal care coordinator. And then I have a program manager who supports the direct service team. And we also have a data specialist and a perinatal outreach and training specialist who provides those trainings to the community and does the initial outreach and intake for our families.
Thanks, Morgan. So I have a question here about before Honey existed, what typically happened for pregnant people experiencing homelessness who are trying to navigate care? So, Maya, I would love your perspective. If you didn't have Honey, what would it have been like? And then maybe Kia, if you wanted to weigh in on that as well. But Maya, I would love your thoughts.
Well, like I said, that I did come to you guys or like find out about you guys in like my second, like towards the middle of my second trimester. So beforehand, it was a bit hard because there aren't a lot of programs that do support pregnant women, and if so, they're not really broadcasted or known about and shared amongst us or whatever. So it's like you really do have to kind of just fend for yourself. There have been a lot of times that before Honey, I was trying to find housing, and they were kind of saying that like, I know it's gonna sound crazy, but like I wasn't homeless enough to be helped, or I wasn't in super dire need, of their assistance, or like you have to go through a few hurdles and things of that sort. Like it's like the specifications are really, really intense. It's like they kind of want you to honestly have just about nothing, like nothing or nowhere to turn, like anything for them to be willing or available to help you.
Thanks, Maya. And I know healthcare can be so fragmented, and the homeless system can be difficult to navigate as well. So Kia, do you want to weigh in?
Well, one of the things we saw that it was a need for the service. One of the things that we did here at Virginia Williams was to work in partnership with Unity Health and Community of Hope, especially when Community of Hope started their clinic. So we encouraged them. We also worked with our partnership at time to transport those households from eligibility to the medical facilities so we could ensure that they were getting touched by a doctor. It didn't stop with the eligibility process that we did here, but we, at least at that point, we were able to get them to a physician to be seen. But the support that Honey was providing, we were unable to do that, but we were able to get them to a physician and hope that they follow through. But at times, we know some of our households are very transit. So it's just a point of getting them there, ensuring that they got there. But Honey, that was one of the things that we talked about when we were having those discussions. What was needed was that ongoing. It may not have been a year. It could be just to touch them to get the other pieces that the household may need that they could work in partnership with.
And I would say as a community health clinic with a prenatal program, not everyone has the same level of care that we have for our prenatal patients. I mean, we have a dedicated perinatal navigators for everybody, whether you're in Honey, or not, if you're part of our program, but that's not true for a lot of healthcare providers. So we're definitely doing some work on a policy basis. How do we get care coordination paid for by Medicaid but that Honey's really, really meeting a specific need there. We have a question here about any advice for those looking to start something similar in other states, especially in the South. And Kia, you started answering this about don't be scared, but if there's something you'd like to hop in to answer there as well.
Yeah, down south is a place, I'm from down south, is a place where the service would be beneficial. I think working first is working with your Department of Health. I think, in the southern states, that's the first place to start, and then look at your shelter system. What does the shelter system look like? Is it privately managed? Is it youth-headed households? Is it families? What does it look for individuals? And build from that. Start those conversations and build from that, and work with your health provider. Find a key health provider that can provide some of the same things or most of the things that Community Hope has that can assist. But I know the Department of Health for those different states would be able to do that. And funding is very important. But if you can start that conversation and get the buy-in and get those services providers to work with you, I think that's the beginning of it.
And Shmuley, I see some of your questions too. Community Hope would be happy to share some of our learnings over this process, some of our staffing, some of our budgets. And it was the proposal to HRSA was a good process to see what data is out there or not. And again, I think Community Hope is unique that we're a community health center and a homeless services provider. Whether you can get that all together in one organization or put a combination together. But really partnering with the local government agency, I think, is also really impactful and an important part of this component.
Can I add one thing, Kelly?
Please, Dawn.
I think it's also very important to speak with families who are pregnant and navigating the homelessness system as well. Understanding the people that you serve or the people that you hope to serve can help to create a program that truly meets their needs. I know that there's a lot of research out there, but oftentimes going into the community and talking to people firsthand about their experiences can really inform what a proposal can look like and can help you craft partnerships and relationships with other providers in your area to truly create a model and a system that reflects the need and can meet the need of the community you wish to serve. So I highly encourage centering the voice of those who are going through the homelessness continuum and navigating pregnancy and postpartum to get a better understanding of their experience and how to serve them best.
Thank you, Dawn. Very important. And I will say that all of this, again, started at the beginning with the CASI work, the Calling All Sectors initiative work. There are some published papers on that, and looking to my team if we can make sure we can send that out, that are really the voices of clients. Some of whom we've heard today about how challenging it is to be both pregnant and homeless and what would be of assistance to them. So very much echo that. We're getting a couple of questions about funding in terms of what our budget, where's the funding come from, and some of the prevention services. In terms of Honey, it is currently fully privately funded with philanthropy. So it was philanthropy and then the federal government to get us to scale, and now we're looking at philanthropy. We're also trying to make sure we're adjusting as we go. What is the right structure? What is the best structure? What are the associated costs to match the need that's coming in? And so part of the reason we're getting out is also to start thinking about policy change, doing a lot of work with the Transforming Maternal Health grant. DC is one of those organizations looking at care coordination. Can Medicaid pay for that? What are some other payment models? How do we make this a more sustainable payment source so that it can be more easily replicated across the United States? So welcome thoughts and suggestions on how we can do that and advance this conversation. The homelessness prevention services, which is one of the questions, is a locally funded amount from the Department of Human Services. It is not HUD funded. And it, I think, has been very impactful in the family system in order to reduce the number of families experiencing homelessness. For Community of Hope operates a homelessness prevention program, and we are at like 95, 96% of families do not enter into shelter. Kia, I don't know if you want to weigh in at all around the homelessness prevention program as well.
It's wonderful. No, it took a lot of work, but it doesn't just start with the family. It also starts at eligibility, having those conversations with the household to see if there is a family member or a friend, or if we can keep you remained in your unit. Which is very important. And then while they're in their unit, they're connected to a case manager with one of our 4 providers, and Community of Hope is one of our homeless prevention providers, which is able to provide wraparound services, getting them connected to other resources. Because a lot of times, once you complete an assessment with the household, you know that it's other barriers that had led the household to their housing instability. So we have really seen a large number of households being prevented from entering our shelter systems because of the resources. It could be case management, first month's rent security deposits, stop an eviction. It could be childcare. It could be applying for benefits such as TANF, SNAP, or Medicaid. So we were able to look at the barriers and alleviate those barriers to get those families towards housing stability instead of instability.
Thank you. And then we have a question about, do we advertise? And this is a little bit tricky. And I don't, so Morgan, I don't know if you want to answer this question in terms of how we advertise for some of the services we provide.
Sure. So because our eligibility is so important, that we only serve folks that are eligible for homelessness assistance through the Department of Human Services. And again, that reason is because we are not housing case managers. And so we need to partner with someone to support all these other things, but we don't do housing and we don't provide housing. And so we don't want to confuse folks when they're coming to us about the support that they will get. So we, I guess, talk about our program with providers. So we have an outreach specialist who goes and speaks to different providers, both healthcare and homelessness assistance providers, about our program, about our eligibility criteria. And that is kind of how we do. We do have information on our website that we have even done a better job recently at, I think, being very clear on our eligibility criteria, because that is one of the things that came out of our program evaluation, that we needed to be a bit clearer about not providing housing. But we talk about the program and eligibility through our outreach specialist. Anyone else can hop on and clarify.
I think you got it exactly right.
Yeah.
I will share that very soon, hopefully later this afternoon, there will be a piece on CNN about the Honey program. And so please stay tuned for that, and we will share that as it comes out. So again, we're trying to get the word out, share the great results and the great impact, encourage people to learn more, and are open to that conversation. So we're coming to an end of our time. Thank you so much, Kia, Morgan, Dawn, and especially Maya. Thank you so much for joining us and sharing your perspective. And I hope you have enjoyed this conversation. We encourage you to stay connected. We'll get some follow-up information, read the evaluation report, email us with questions if there's other ways we can be helpful, other people you think we should be talking to. And again, thank you so much for joining us, and happy Friday, and happy Black Maternal Health Week. Thank you so much.